Hello friends, in continuation to my talks on Uroflowmetry, in this video I shall be talking to you about the another aspect of this test, that is do's and don'ts before the test, right? So this is clinically very relevant for all of you to know and use them in your day-to-day practice. Now, what must be done before the test? The patient who is going to do this test, right? The patient should be, first of all, mentally relaxed to undergo this test. And somebody must have explained to him in details what is he expected to do inside the laboratory or inside the washroom when he is doing the test. This is very, very vital for success of this test. Then the urinary bladder of the patient should be appropriately full. Now when I use this word appropriate, I say it should not be underfull. That means it should not have urine less than 150 cc, and it should not be overfull. It shouldn't have urine more than 450 cc, right? On both extremes, it is not a reliable test then. The rectum of the patient should be reasonably empty. He should have defecated appropriately. Appropriately means he should not be having either loose motions or he should not be having a loaded rectum. In both the situations, there will be influences on performance of urinary bladder and this test. The place, the laboratory or the washroom where this test is being done is also important, and you must provide reasonable privacy to the patient, and the place should have a good level of hygiene. So these are 4 areas where you need to think about, and you have to provide all of them prior to the test, right? A calm, well-explained patient, appropriately full bladder, appropriately empty rectum, and a hygienic private place. Then next you should know what must not be done. For the patient, when you see the patient in your OPD, don't push the patient to do the test right then and there, because your time is less or patients come from a distance. There can be many social factors. Relatives may be wanting the test to be done right now. So there are many things which press on the patient to do the test. Don't push the patient beyond the limit to do the test the very same time. And then patient should not be made to do this test in unfamiliar position of urination. There are some people who avoid in sitting position. Some patients pass urine in standing position. Then you check with the patient which position he is comfortable with, and that is what kind of position he should use. When you want to do this test, sometimes rather quickly, you ask the patient to drink a lot of water or a lot of liquids, and then the bladder gets rapidly filled. Now, if you are filling the urinary bladder rapidly, that's not physiological way of filling the bladder. And after that, the contractile power of urinary bladder may be adversely affected. So don't try this rapid bladder filling maneuvers. On a same pretext, if the patient has made his bladder reasonably full, and if he has to wait to undergo uroflowmetry test 10 minutes, 15 minutes, half an hour for various reasons, then this is also not correct. If he's holding urine in the bladder for a long time, then also his urinary flow rates will be affected. So I hope you got my point. So don't achieve a rapid bladder fill and don't have a prolonged bladder fill prior to doing this test. Sometimes you ask the patient whether you have passed motion properly prior to the test, and patient is not sure. And to save your time, to save patient's time, maintain the appointment, you try and give provocative enemas, or you may give some medicines, or you apply rectal suppository to empty the bowel. Now that's not what should be done prior to uroflowmetry, because then also it will adversely influence urinary flow results. And finally, in the laboratory where the patient is undergoing uroflowmetry, in a busy units, often there occurs queue. First patient, second patient, third, fourth, like that. Now, if there is a patient's queue to undergo this test, then third patient may be waiting little more, second patient or fourth patient may go a little early. So this queuing up has to be very seriously controlled if you do more than 4, 5, 6 uroflowmetries in one go. And then the patient who's standing in queue bound to get anxiety. When might my turn come? So that leads to anxiety in the patient and results get influenced. So this is what you should understand, what must be done and what must not be done prior to the patient start doing his urinary flow test. Also, when you have the uroflowmetry report in front of you, you must check with the patient. Are you happy with this test? The patient may be unhappy because of some reasons. Say for example, patient may say, when I pass urine at home or my office, it is different. I passed urine in the lab and you have the test of which it was not the same as it is in my home. So it is not a true replica of his urinary flow system. So it's a fallacious test for all practical purposes. Patient may come and tell you that I was not very comfortable when I did this test and I had this problem, that problem. If patient is unhappy because of these reasons, please consider it, right? Similarly, as a doctor, you may be unhappy with the report that is in front of you. Say for example, there may be issues related to the volume voided by the patient or the volume of urine present in the bladder. If it is too low volume, the test is not good. If it is too high, then also test is not good. As I said in the beginning, you have to be in the middle. There may be technical issues which you see in the uroflowmetry graph. For example, there may be spill of urine outside the uroflowmetry machine, or there may be equipment failure during the test, electricity failure, equipment failure, or there may be, some patients, when they pass urine, they pour water on their genitalia, particularly in some religion. They pour water on their genitalia and the water goes in the uroflowmetry machine. And nobody told this patient before that don't do this. And it did this at the end of the test. And when you see the report, uroflowmetry results and then another peak at the end of it. So it becomes fallacious. So if with the strip that you're seeing for the first time, if the patient is unhappy or you are unhappy, then please repeat the test without any charge. The moment you say the patient that you will be charged again for the test, then there's anxiety component into it. So don't charge and do the test. And second time, probably you'll be fine. So thank you very much for being with me to understand this aspect of uroflowmetry, what must be done and what not be done prior to the uroflowmetry testing or prior to making an interpretation from the report. Thank you.